So some of the kinds of things we're going to need to think about relative to kids with ADHD, again, are conduct problems, such as oppositional behavior, academic underachievement, specific learning disabilities, social skills, and social interaction problems. Okay, so these are primary co-varying kinds of problems that kids will present with, and we need to be aware of them and think about how we're going to integrate support for these issues with respect to support for intervening with the primary symptoms of inattention and impulsivity. These are reasons why medication alone, while it can be effective in helping to manage symptoms, most often is not sufficient. Okay. What's important to recognize with respect to ADHD and learning problems is it's critical that we not over-focus on managing the ADHD symptoms, the impulsivity, the inattention, the hyperactivity, without carefully attending to academic achievement and academic development, and carefully attending to social interactions and social development. Okay. A couple of my students have done dissertations. They're not published yet. I don't know if they'll ever be published, but that's a different issue. But looking at 4- and 5-year-old children diagnosed with ADHD, they meet all the criteria. We said they're at risk for developing ADHD, but they met the criteria. We monitored them in 2 different studies over the course of the year on Dibbles-like measures, and found that relative to the 50th percentile in 2 large school districts, the kids with the ADHD symptoms were significantly below in terms of things like phonological awareness, letter identification, phoneme segmentation, significantly below relative. Their trajectories kind of look like, if that's the 50th percentile, theirs were down here. Okay? So at 4 years old, the kids with the ADHD symptoms were behind their typically developing peers on reading readiness related behaviors, and in kindergarten they stayed there throughout the kindergarten year without intervention. We just monitored them. Okay, what that seems to suggest, well, that concerns us, or should concern us, because kids with ADHD, we can identify them relatively early in many instances, and we know that they're probably going to be behind academically when they walk through the door. Okay, it's probably the case, the way I think about it, it's probably the case as a parent, it's not as easy to sit down with your child with ADHD and say, come sit on my lap, let's read a book together. Okay, that'll last for a minute. Okay, it's probably easier to do some other things. Children with ADHD, young children, probably get less exposure to reading together in a very structured way and exposure to book and print material. It's not that they don't get any, but it looks as though they get less than their typically developing peers, probably as a function of their behavior patterns. Okay, so we want to be aware of that, and if you transfer that idea to the school setting, it's also the case that they're going to get less academic instruction or interactions. If we talk about the older kids that we know, that they're off task quite a bit. They get less opportunities to respond. They get less interaction with the material. So we want to be aware of that, and we want to be aware of it early on. So, does that make sense? So, always, when we're thinking about ADHD, or we have identified a child, we want to do some type of academic performance assessment to be able to understand how's this child doing academically relative to others of the same age and same gender. And if we can do that early on, that's going to be important as well. We want to think about, that relates to doing a skills analysis. So oftentimes with ADHD, we confuse can't do and doesn't do. Okay, so oftentimes children with ADHD can do something, but they do not do it under the typical conditions under which we expect them to do it. So it's important to understand, and people say he can't pay attention, he can't do his math work, he can't do this. And again, I'm not blaming people, that's the that's the vocabulary that people have learned to use. But with kids with attentional problems, it's often the case that they actually can do it, but they do not do it. Okay? And so our job becomes to figure out how can we arrange the environment such that they do it under the conditions when it's expected. Okay? So we have to help separate out the cannot do from the will not or does not do issue. And so we, in some sense, if we're talking about standardized testing, we'd be looking at testing the limits, right? He didn't do well on this standard in answering these 3 questions, but I'm going to go back and ask those questions again in a little bit different way. Or tell me how you got this answer. And I figure out, actually, that the child can do it. Okay? And again, remember, the kids with ADHD, they tend to be impulsive. Remember what I was saying. They tend to make errors of omission and commission. So we have to do a relatively careful analysis to really understand what they can do academically in terms of different types of basic skills or different types of content area knowledge and abilities as well. So we want to think about this conditions and skills analysis issue as well. Okay. So we want the idea of targeting performance-related behaviors. We want to think about things rather than focus on, for example, we do a lot of focusing on task and off task. Okay, ideally in schools we want to focus on work completion and work accuracy. Those are 2 big target behaviors that we want to focus on. All right, work completion and work accuracy. The reason I say that is you can't get high rates of completion and accuracy without being on task. Okay? But you can get high rates of on task, or what looks like on task through observation, without getting lots of work completion and accuracy. Okay? You can also get high rates of work completion and accuracy if you're under your desk, as long as you have your pencil and your paper with you. Okay? I don't really care where the child is doing it. Okay? Some people do. So sometimes we have to think about that as well. Okay? But if you focus on work completion and work accuracy, you'll be focusing on the most important and functional aspects of things. Okay? And this issue of skills and conditions analysis, it also raises the issue of understanding from a child's point of view what they can do and how well they do it. So kids with ADHD reliably overestimate their academic skills, and they reliably overestimate their social prowess. Okay? So how are you doing out on the playground? Great. Everybody loves me. Everybody wants me to be on their team. I get along with everybody. And so you go out on the playground and you do some observations and you find out that this is a child who's kind of by themselves, that everybody else is kind of avoiding them because they get in trouble if they hang out with that particular student. So we have to also, in terms of this sort of skills and conditions analysis, we also want to start to understand how accurately the child perceives his or her abilities socially as well as academically. And we have to help them think about accurately estimating their own ability. All right, so I already mentioned that with respect to young adult outcome, it seems like the absolute level of symptoms decline, but most children continue with several disabling symptoms. They typically do less well in terms of educational outcomes at the secondary level, and they are more prone to the potential for developing conduct problems and more prone to accidents, whether those be walking, driving, playing, whatever they might be doing. They're more prone to accidents and more prone to adjustment difficulties. Okay? When we get into adulthood, that continues. So you see more marriages and divorces, more accidents from driving and other issues, and also more adjustment difficulties. And because of those things, adolescents are at risk for depression as a function of having ADHD, especially if they're doing poorly socially and poorly academically. Okay? And so this is sort of an interesting path. It's not like a direct path like ADHD causes depression, but it tends more to be that you have a child with ADHD, their academic skills don't get addressed fully and their social interactions don't get addressed fully, so over time they have fewer friends, they have difficulty making friends and fitting in socially, they're at risk for school failure and dropout, and so that's not a fun place to be. They develop poor feelings of self-worth and they're at high risk for depression. But a lot of kids also have a satisfactory outcome. Okay, so it's not. I don't want to. It's not a horrible picture. It's not an easy picture. Lots of challenges.